Well, I am an intensivist in Brazil. I work in a federal university, in a public hospital, and as an intensivist, I take care of patients, severely ill patients. I might say that the biggest challenge is how can we take care of patients and at the same time that we're trying to save their lives, we also respect the fact that we might fail. So sometimes it's very hard for us because we have to discuss with family, end-of-life care. So I would say the biggest challenge is how to face our failure, how to face death. Yeah, I think that one of the solutions is just to develop our skills on how to speak with our patients, with our families, and also certainly how can we improve our capacity to save lives. I mean, we can be better doctors, better nurses, better healthcare allied professions. And I think sepsis drove my attention because it's such a important cause of death in our ICUs. Not only in people with risk factors, so many people with stroke and cancer, they die with sepsis and not from sepsis, but also we have a lot of healthy people that can develop this deadly disease. So I think that the most attractive factor is because I believe that with quality improvement, raising awareness, we can save more lives than dealing with other sorts of disease, because it's so frequent. There's a lot of epidemiological studies and a lot of randomized controlled trials trying to assess multiple aspects of sepsis. And I think this is of utmost importance, not only to know better the epidemiological data and to face better this challenge, but also because regarding treatment, we might have some aspects that are quite different from high-income countries, mostly in low-income countries, where the resources are not always available. From the government, I think that we need national policies about sepsis. And 2 years ago, we have a great advance on this scenario because WHO, the World Health Organization, and the Healthcare Assembly, they approved a resolution in prevention, diagnosis, and treatment of sepsis, recognizing for the first time that this is a public health problem, a huge healthcare problem. So before this, we could not find anything about sepsis on WHO website, except for neonatal sepsis, maternal sepsis, and some very few stuff. Because I think that if we can recognize sepsis earlier, we will, it will be easier to give adequate treatment. And this, in your second point, it's, I think, a responsibility of healthcare professions to study, to learn about sepsis, to learn how to recognize sepsis earlier in the process, and of course, how to treat it. It's not difficult to treat sepsis. It's quite simple if you have the early recognition. And on the third part, I think that the industry, they can help us because they can add us with their technology. Yeah, I think Mitre is a huge company in Brazil as well. And they're a very good partnership, I mean, from the societies. We're also always seeing them supporting, teaching, training. It's just because Mitre has this good thoughts about how can the companies and the societies and the universities be a partner together to improve patient care. We do need some technology. There are some studies showing, for instance, that electronic alerts for sepsis might help. We are not sure about this, but anyway, it's a way. If you have electronic medical records, they might help in recognition. And of course, in the ICU and on intermediate care units, technology can help us monitoring the patient and giving him a better treatment. I think because they allowed us to be more fast. I mean, we have to make quick decisions, we have to change things very fast. So if we have a friendly device, it will be easier for us. I think that at this moment we have a lot of stuff in electronic alerts, as I said. We don't have good studies on it that allow us to see if it really help, if they are better, because there is the fatigue problem. But I think this is a way to go. And another way, as I mentioned, is because when we are in the intensive care, we need to assess the patient in a more sophisticated way. So devices that allowed us to assess fluid responsiveness are very important in sepsis. This is that is a huge controversy at this moment. How much fluid we have to give to this patient. Certainly monitors and ventilators, certainly. I think they are the basics for everything that we do in an intensive care. I would say that many of the ventilators have high technology inside, but the interface, it's not good. So I think that the most important thing is have a good interface. It has to be a friendly equipment that we don't feel challenged to deal with. And also on the ventilator part, I think that devices that allowed us to measure asynchrony, because the basics are the basics. We know how to deal with the basics. But one of the problems that we face now, it's a patient's asynchrony with the ventilator. So a new device that can help us to see this are certainly important. I'm not sure that they will help make decisions, but they will remind them. I mean, if you have a checklist that you can follow during the first hours of sepsis, this might help. So having a checklist in a monitor might be interesting, and this is one good thing. Of course, one of the interesting things that all the recommendations of the Surviving Sepsis campaign are inside, so it can also help physicians to remember something that, should I do this or do that? What Surviving Sepsis campaign tell us about this? And so they can quick look at it at bedside. So this is also a good point. I mean, I think that in the future things are going to be easier to deal with. They might help us trying to solve these controversies like I just mentioned, fluid responsiveness. So I think it's also possible that machine learning and analyzing big data can help, and we will need technology for this. So maybe in 15 years we are going to drive our decisions based on what the machine tells us to do. I'm not sure about this. I'm afraid maybe on the future on this, but I think this will be one feature in the future. Well, we're going to need the technology to analyze data and to sort out what are the best solutions for that given patient. So in terms of artificial intelligence, technology is just fundamental.